news day continues here on One News Now. I'm Riza Diaz. The search for the missing crew members of the LCT Cebu Great Ocean continue, with 7 members still not found. Jeva Masenya has the rest of the story.
Search, rescue and retrieval operations are still ongoing along the shoreline of Agusan del Norte and Surigao del Norte as 7 crew members of LCT Cebu Great Ocean remain missing, including the ship's captain, Mario Palacio. Earlier yesterday, 2 more dead bodies were found in Barangay Oslao in the town of San Francisco and in Barangay Balite, bringing the total confirmed deaths to 6.
Sa Barangay Oslao yon, natagpuan yung first, which is identified na ngayon as si Clint Oxtero, based sa mga relatives, no? So si Clint Oxtero natagpuan sa walang buhay sa Barangay Oslao. Then yung isa sa Purok 7 sa Balite, yung pa hindi na identified natin.
7 survivors have been rescued since Tuesday. 6 of them are still being treated in the hospital but are all in stable condition and will be discharged soon. All of them suffered from sunburn and dehydration. Meanwhile, Philippine Coast Guard closed the resort where the ship ran aground for security reasons, as the extraction of oil and diesel from the vessel is ongoing. Some family members of the missing crewmen traveled to Surigao del Norte, hoping that they could still find their loved ones alive. We tried to get statement from the representative of the shipping company the crewmen work for, but he refused to comment. PCG already stated that they will conduct investigation after the search and retrieval operation. For News 5, Jem Avancenia, we are One News.
Now, studies show that COVID-19 can still kill survivors even months after infection. More of this on Bloomberg Quick Take.
Even if people survive the acute illness, the people really are then, survivors of COVID have still higher risk of death than a comparative group of people who did not have COVID. So it's deadly even beyond the acute phase. And we think, so when we're looking at the acute phase, we're really pretty much looking only at the tip of the iceberg. We're starting to see a little bit beneath of that iceberg, and it's really alarming. Sad, but not really surprising that, if COVID is also manifesting in all these conditions and giving people memory problems and blood clots and new onset diabetes and heart failure and acute heart disease, that will also be associated with higher risk of death. So it's really not totally surprising, but it is a sad reality. So now we're seeing, at least in this long COVID people, increased intake of pain medications, including opioids. So because of the number of people with COVID and subsequently the number of people with long COVID, this is not going to be a small issue in the United States. So those are going to be, thousands and thousands, potentially millions of people, having depression and anxiety and new onset diabetes and, taking pain medications. And what we worry about source of opioids, we are in possession of knowledge that long COVID exists. We know that it's really multifaceted. We know that it has, metabolic manifestations. We also know it has manifestations in the mental health system, including depression and anxiety and substance use disorder. We already did not do very well preparing and dealing with COVID. Let's not make that mistake a second time.
Meanwhile, the United States has joined the search and rescue party for a missing Indonesian Navy submarine lost in the Bali Sea. This as hopes begin to fade for the 53 crew members who are expected to be running low on oxygen, if not totally cut off. The Indonesian Navy said it was sending search helicopters and ships to the area where contact was lost with the submarine on Wednesday. Australia has likewise deployed a sonar-equipped warship with a helicopter to help the submarine hunt. Concerns are now growing that the submarine may have already been crushed by water pressure. Now here are other developments we're following around the globe. The United States can now immediately resume the use of Johnson & Johnson's COVID-19 vaccine mere days after implementing a pause to investigate the vaccine's link to deadly blood clots. US CDC and FDA say the risk of experiencing these adverse effects was very low, finding only 15 cases in 8 million shots given. In their analysis, the CDC found that blood clots occurred at a rate of 7 per 1 million doses in women under 50, while for women over 50 and all men, the clots appeared at a rate of 1 per 1 million doses. In all, 3 deaths have been recorded. With the FDA giving a go signal, the Janssen vaccine may be given to people in the United States as early as tomorrow. Japan declares a 3rd state of emergency for Tokyo and Osaka regions just 3 months ahead of the Summer Olympics. The move aims to be short and intensive to prevent the spread of the virus during Japan's Golden Week holidays. Now, the declaration also came after prefectures requested enhanced measures to combat the spread of COVID-19. In India, COVID cemeteries are at their threshold as coronavirus cases continue to surge. Reuters reports that India has logged the world's highest daily tally of COVID-19 infections for a second day on Friday, surpassing 330,000 new cases. India's death toll rose suddenly this year with around 2,200 deaths just in the last 24 hours. Officials across northern and western India warned that most hospitals were full and running out of oxygen. Meanwhile, daily infections hit over 332,700, up from around 314,800 the previous day when India set a record that surpassed a U.S. tally. Hospital beds have also become scarce, with major hospitals putting up notices saying they have no more room for any more patients, and police are now fanning out to secure oxygen supplies. The pandemic has pushed India to the brink of a humanitarian crisis as the South Asian country continues to shatter global infection records. Johns Hopkins Center for Health Security senior scholar Jennifer Nuzzo discusses that in this video from Bloomberg.
Oh, I mean, we're on the brink. The stories that really worry me the most is hearing about shortages of medical oxygen. I mean, to think that, you can save people's lives by supplementing their oxygen and they just don't have it. Oxygen, something that's easy to make, that is really, I think, a severe tragedy.
How close are we to where there will be a call for international developed nation and American responsibility to assist India?
Oh, we are there. If the call hasn't already been sounded, let's sound it now, because there is clearly a deep, deep struggle there and they need help. And, the United States is not going to be back to normal, fully safe until we help countries end these very concerning surges of these cases.
Based on the surges that we have seen, how much has the end of the pandemic been pushed out?
Well, I mean, it's really hard to say. I mean, we still have parts of the globe that haven't gone through this yet. And you don't want any country to go through this where you see a massive surge of cases. But any country that has not yet had a surge of cases and is not actively vaccinating its population remains at risk to exactly this scenario. I think earlier there were countries that maybe breathed a sigh of relief that somehow assumed that they escaped the worst of this pandemic. But we're seeing quite clearly that that's very much not the case, that many parts of the world still remain deeply at risk. So I worry about these headlines continuing for a year or more unless international partners get together and help share some of the vaccines that are there. We need to absolutely make more vaccines. There's clearly a shortage of medical supplies that needs to be addressed. So a lot of work that the globe can do to help countries and to, try to lessen some of these hideous tolls that the pandemic's already had.
There is so much pressure to take some of the supply here and allocate it to the rest of the world where it's needed most right now. How do you make a decision like that when some parts of your country have decided they don't want this vaccine?
Sure. Well, it is a tough decision. And, every elected official, their first responsibility is to the people who elected him or her. In this case, though, the United States has more vaccines than we need. Even if every single American were to get a vaccine, we still have more than we need. And so I think it is important for us to consider donating, at least to cover some very high risk groups like healthcare workers that are working across the globe. They show up every day, put their lives on the lines to save people's lives. We should be able to protect them, and the U.S. has enough vaccine to be able to help in those efforts.
And those are the top stories of the hour. Join us later at 2 in the afternoon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.